continuing our vitamin education from last week when we talked about B12, today is going to be about glutathione. Glutathione is one of my favorite things that we give. And so what is glutathione? Glutathione is a peptide that our liver makes. And its whole role is to detox. It's an antioxidant. It's a tripeptide, meaning it's made up of more than one. It's composed of glycine, glutamine, glycine, and cysteine. Cysteine is the rate limiting aspect of it. So that means that if your body does not have cysteine, it cannot make it. If it's lacking one of the other two, it can. So rate limiting, it just means that it cannot make it without having the cysteine. So cysteine is a big important part to get into it. So fun fact, cysteine, we administer that in the hospital, and I did not understand the correlation until I started learning about all of this stuff. Cysteine is NAC, N-acetylcysteine, and what do we give that for in the hospital? A lot of times we give it for Tylenol overdoses, and the reason why is because it can help remove the toxins that essentially are built up because of the excess Tylenol that we have taken, and it detoxes our liver. Well, this is needed because it stimulates our body to produce glutathione, and that's what does the detoxing. So glutathione is just the whole peptide itself. And so why would we give it? There's actually several reasons why. So in our personal clinic that we give, there really is so many things. So we'll start on the wellness aspect. When I say wellness, these are going to be addressing things that are going to be, we have a continuum. You have your healthy adult that has nothing wrong with them. This is very rare nowadays, especially in America. We have the middle where you're having some symptoms that may not be concerning to you at the moment, but they are things like fatigue, brain fog. There are things that are not 100% that in America we think is normal, but it's not normal, and it's a step before the disease state. Our medical community, majority-wise, unless it's functional medicine, we don't really treat things unless we are at that disease state. And so what we do, we try to address it in that middle state to prevent us from getting there. And so what we give along with lifestyle modifications really can do that. So from the wellness aspect, glutathione is used to treat oxidative stress. What is oxidative stress? So in simple terms, think about if our cells are the most basic part of us. Whenever they go through one of their little cycles, they have waste, and this is called a free radical. I'm just going to interchange the terms free radical and toxin. This is normal. Our body's antioxidants will pick up this free radical, and then we will dispose of it in, our urine or stool, depending if it's water soluble or fat soluble. Because we live in America, we're doing a lot of things to our body that increase more toxins. So we already have, the normal free radicals and toxins that build up just from our body working. But then we are adding extra things on it that pretty much by anything that is putting stress in our body. So if we are not sleeping enough, if we're having excess caffeine, certain medications can. Actually, if you take Tylenol, it depletes your glutathione. And let's see what else. If you're sick, if you're working out too much, if you're stressed, all of these things that put stress on our body create more of a toxin burden. And if we are not doing the things that we need in order, we are not replenishing these antioxidants enough. Glutathione is the main one, and I'll talk about it in some other videos. There's some other key antioxidants that glutathione needs in order to work, but we're just going to focus on glutathione for this video. So we replace glutathione because, of course, since it's something our body makes as we age, it's something that decreases how much is made as well. And a lot of us are, we don't have as much as we need, and that's why we have these middle symptoms such as fatigue. Again, let me rephrase, because this is it's very personalized. Everyone's different. That's why we look at your lifestyle, but we'll just use me for an example. I'm an overall healthy adult. I don't really have any past medical history. I don't take any medications. I have no reason to feel fatigued and everything, unless for me, I know it's a lifestyle thing, I didn't sleep enough last night, or, whatever it may be. So if I am doing it doesn't have to be 100%, but doing majority of the things that I need to do, and I'm still having these fatigue and everything else, there's some sort of imbalance there. And that's where replacing glutathione is like a key factor that it can help decrease the oxidative stress by increasing the antioxidant load, because that is what removes these toxins. And then generally after a couple of months, again, it depends on people's lifestyle and their health history and whatnot, but that's when you can you might not be able to 100% get rid of the fatigue and the brain fog and the constantly getting sick, but you're able to drastically improve it to where you're able to feel better. And that is kind of the role that glutathione plays in that aspect. And so let's kind of talk about how glutathione works in the body. So it has two forms. It has a reduced and an oxidized. Reduced means that it is open and it can go pick up a toxin. It's like it's ready to pick it up. Oxidized is whenever it's already full, so it cannot pick one up. And so it has to have certain cofactors or things to be able to switch in between each form. And that is very important to know, because if you're not assessing what patients are supplementing with or their diet, or even that's why some random, infusion places, when they just administer glutathione and say this person is like never taken, they're not healthy, they don't do infusions. A lot of times you're giving them glutathione, but then they don't have all of the cofactors or things that are needed to keep the glutathione cycling. So yes, it'll work, but it's not going to work long term, or it's not going to be able to cycle very much because it does not have the cofactors that is needed. So that's kind of how we use glutathione on a wellness aspect. And so this also, when we have oxidative stress just in general, then remember, this means we have higher amounts of free radicals than we do antioxidants. That's whenever our body starts to become damaged. So our cells start to become damaged. Well, if our cells are damaged, depending how long this goes on, this is when they start to become dysfunctional and not work like they should. And that is where we can get that to that disease state, because if you have, depending on what type of cell it is in your body, we have different types of cells in all of our body. That is going to determine and kind of can play a role in like, okay, what disease is, this leading to? So that's kind of how we address it. So it's supporting longevity and wellness, but it is addressing a specific issue. I feel like a lot of times we're like health and wellness, that's healthy people doing stuff. Well, actually, a lot of times we're doing things either to like reverse back to a more healthy stage or keep us in this stage. That way, when we're aging, our cells are staying healthy and aging better, so we feel better. So a lot of this is geared towards cellular health, and cellular health is so important, and infusions can play such a big role, but they also can be amplified by other things like red light therapy, diet. There's so many things that you can do. So let's talk about from a acute standpoint. So we have, remember, two categories of infusions. We have our wellness, which we just talked about, and then we have our acute or like sick infusions. And so these are going to be infusions that are one time addressing a specific thing. So this could be if you are hungover, you have an upper respiratory infection, you have a GI bug, you're dehydrated, any of that stuff is kind of like a one-time infusion. You don't need to keep going. And so, and let's just say, for instance, with you're hungover. Actually, if you give glutathione when you're hungover, a lot of times the hydration alone will make you feel better, but that glutathione will like really help kick in because it helps metabolize that alcohol. And I mean, obviously you're hungover, you feel like crap. So glutathione plays a big role in that. But also, if you have like, an acute illness, that's going to put more stress on the body. And so if they're just trying to like acutely get over that hump, having glutathione and, its cofactors in the infusions, that kind of helps put less stress on their body and kind of helps their body out over whatever hump or whatever illness they have. So it kind of depends. And you'll see a lot of infusion places, they don't educate it like this. It'll be like, oh, you're this, let's do this. And really, there's a lot more to infusions than just like, oh, you're hungover, let's do an infusion. Like, yes, those are great and they can be very helpful, but there is actually a lot more science that goes behind it. And really looking at how these things work at the cellular level is when you really start to understand like, oh, this can help with this, or this can help with this, or this is how our body ages, and this is what happens as we age. So if I can help replace this, then I can help prevent this. And that's really what we address. And so those are the different ways that you can use glutathione. Next week, I'm not sure what we are going to talk about next. It might be NAD. NAD kind of correlates with this. Actually, we're going to talk about NAD next week because it kind of goes hand in hand with this. So wellness aspect, Glutathione is used to detox. From an acute standpoint, it's really just used to kind of help get them over that hump that their body is over, that like extra stress that they're going through from whatever illness or whatever they have going on at that time. I'm Tiffany. Like and subscribe, follow for more, ring the bell. That way you get notified every time that I release a video, which is every Wednesday. And I will see you guys later.